901, young patient arrived to ER with burn in his left arm and his weight 48 kilograms. How to calculate fluid requirement for the patient according to Parkland formula? A. 1,572 milliliters. B. 1,220 milliliters. C. 1,728 milliliters. D. 2,000 milliliters. The answer is C. 1,728 milliliters. 902. A 75-year-old man is scheduled to undergo phacoemulsification surgery. The nurse meets with the family for a preoperative. The patient has a diagnosis of Alzheimer's disease with memory decline. The family says that he has become increasingly fragile and that his emotions are unstable. Which of the following actions the patient is expected to do operation? A. Lay supine for 20 minutes. B. Sit without moving under laser. C. Consistently speak clearly. D. Tolerate general anesthesia. The answer is D. Tolerate general anesthesia. 903. A nurse admits a client sent from the healthcare provider's office. The nurse calls the provider to obtain prescriptions. Which action does the nurse take? A. Hold treatments until the provider signs the prescriptions received. B. Read each prescription back to the provider prior to ending the call. C. Have the provider provide the prescriptions to another nurse as well. D. Verify the prescriptions with the charge nurse before beginning treatment. The answer is B. Read each prescription back to the provider prior to ending the call. 904. ABG reading was low pH, high PCO2, normal HCO3. What the interpretation? A. Compensated respiratory acidosis. B. Uncompensated respiratory acidosis. C. Metabolic acidosis. D. Metabolic alkalosis. The answer is B. Uncompensated respiratory acidosis. 905. A 47 years old, newly been diagnosed as having gastroesophageal reflux disease, GERD, comes to the clinic for follow-up appointment. The nurse prepares health education on the cause and care of GERD. Which of the following stomach area is associated with the diagnosis? A1. B2. C3. D.4. The answer is A1. 906. 3 years old, has returned to the clinic after 4 days of being diagnosed with gastroenteritis and dehydration. A parent reports that the vomiting has stopped, and the child is tolerating liquids, rice, applesauce, and bananas. The diarrhea persists, but seems to be decreasing in volume. When evaluating for signs of dehydration, the nurse will assess the patient's skin turgor by A. Grasping the skin over the abdomen with 2 fingers and raising the skin with 2 fingers. B. Grasping the skin over the forehead with 2 fingers and raising the skin with 2 fingers. C. Holding the patient's mouth open and assessing the tongue for deep creases or furrows. D. Drawing 2 tubes of blood and running blood urea nitrogen, BUN, and creatinine, CR. The answer is A. Grasping the skin over the abdomen with 2 fingers and raising the skin with 2 fingers. 907. To decrease the anxiety of a 10-year-old girl who is undergoing surgery. Which of the following should the nurse do? A. Use a heart model to show her how the surgery will go. B. Provide her with verbal explanation of the upcoming surgery. C. Give her a book to read about the surgery 2 weeks prior. D. Let her parents talk to her about the importance of having surgery. The answer is A. Use a heart model to show her how the surgery will go. 908. An infection control nurse notices purulent exudate, redness and tenderness on the surgical wound site for a few postoperative patients in a surgical unit. She discussed with the ward nurses and emphasized that wound infection after surgery can be prevented. Which of the following is the best possible action to minimize the incidence of wound infection? A. Perform assessment of pain on the wound site. B. Wash hands before and after each patient activity. C. Encourage adequate intake and early ambulation. D. Support incision appropriately and avoidance of straining. The answer is B. Wash hands before and after each patient activity. 909. A nurse is giving health education regarding the management of premenstrual syndrome symptoms to a group of first-year nursing students. Which of the following information regarding diet will the nurse include in the presentation? A. Take 3 healthy meals a day to prevent hypoglycemia and increase feeling of well-being. B. Include simple sugars in the diet to prevent low blood glucose levels, which cause mood swings. C. Drink 2,000 milliliters of fluid, water, coffee, tea, per day to flush the kidneys and improve fluid retention. D. Decrease intake of caffeine, such as coffee and chocolate, to minimize irritability, insomnia, and anxiety. The answer is D. Decrease intake of caffeine, such as coffee and chocolate, to minimize irritability, insomnia, and anxiety. 910. Name the complications of hepatitis C. The answer is liver cirrhosis, liver cancer, and liver failure. 911. A diabetic mellitus patient had left low knee amputation. The nurse in the surgical unit has been doing wound care for 3 days. The nurse evaluated the wound's condition to review the care plan. Which sign shows poor glucose control in wound healing? A. Swelling of the stump. B. Bleeding of the stump. C. Mild redness of the wound site. D. Separation of the wound edges. The answer is D. Separation of the wound edges. 912. When examining the tympanic membrane of adult by otoscope, the nurse should move the adult pinna in which direction? A. Down and forward. B. Up and back. C. Up and forward. D. Down and back. The answer is B. Up and back. 913. When examining the tympanic membrane of infant by otoscope, the nurse should move the infant pinna in which direction? A. Down and forward. B. Up and back. C. Up and forward. D. Down and back. The answer is D. Down and back. 914. Client has just returned to a nursing unit after an above-knee amputation of the right leg. The nurse should place the client in which position? A. Prone. B. Reverse Trendelenburgs. C. Supine, with the amputated limb flat on the bed. D. Supine, with the amputated limb supported with pillows. The answer is D. Supine, with the amputated limb supported with pillows. 915. Patient with ongoing blood transfusion and the nurse observe that patient has difficulty to breathing and shivering. What the nursing priority? A. Stop infusion. B. Call physician. C. Slow rate of infusion. D. Give intravenous fluid. The answer is A. Stop infusion. 916. A 70-year-old man is brought to the emergency department on a wheelchair. He complains of drowsiness, fatigue, and lack of appetite for the past 3 days. With history taking, the patient stated that he did not eliminate since 5 days and he is not ambulating a lot because he has arthritis in both knees. Why is constipation one of the common problems for immobilized patients? A. Decreased peristalsis. B. Increased colon motility. C. An increased defecation reflex. D. Decreased tightening of the anal sphincter. The answer is A. Decreased peristalsis. 917. What is a minor surgical procedure that refers to puncture of the tympanic membrane with a small gauge needle in order to aspirate fluid from the middle ear? The answer is tympanocentesis. 918. Otitis media surgery is? The answer is myringotomy. 919. Suspect patient with H1N1. What is the highest priority nursing action? A. Isolate the patient in private negative pressure room. B. Take nasopharyngeal swab. The answer is A. Isolate the patient in private negative pressure room. 920. Fill in the blanks. Definition: average pressure in a patient's arteries during one cardiac cycle. The answer is M. A. P. Mean arterial pressure.